and good morning to everybody. We're really pleased and grateful that you could take some time to join us this morning to talk about a new and very important piece of legislation that's about to be introduced into the Assembly of the California State Legislature. We're pleased also today that we have the author and the co-author of the legislation who will introduce in a few moments. And we also have a number of frontline healthcare workers and patients to speak to their own personal experience and history with what's transpired, in this enormous pandemic that we've all been coping with for the last year. Before we get into the particulars, I just want to begin by saying, that it's not a surprise to anybody or a mystery to anybody that we've just been through and are still in the midst of this extraordinary public health care crisis in our country and in California. It's been almost a year to the day since California declared a shelter-in-place status, and we've all followed the news as patients and healthcare workers, and all of us have just struggled to cope with the devastation and the loss and the fear and the reality of what COVID has meant. And before we get into the particulars of the legislation, we have a very short video that we think sets an important context and gives us an opportunity to hear the voices of frontline healthcare workers themselves who work up and down across the state of California to just provide some context, and then we'll return to the particulars of the legislation and the other guests that we have in today's session. So I'd like to ask if we could share the video at this moment.
Many of us have already seen cases of the novel coronavirus or the COVID-19.
Put away our fears, get out there.
Anxiety is high right now.
Today was the first day I had my mask.
Especially with the issue about PPE.
It's already written. We're expected to use this one for the next 14 days.
One yellow mask assigned to us per day. We have to wear it all 8 hours.
If we can't protect ourselves, how are we to protect others in our community?
Behind me, you can see people have hung up their shields after they have cleaned them.
There are no eye protection. There is no face protection or
the
face
hospital.
shields.
I have an elderly grandmother that I take care of once I leave my shift at Kaiser, and that contracting this disease and bringing it to her
I've
to fatal in her case.
chosen to have my kids stay with family members. It breaks my
I remember
heart.
seeing them one last time a few weekends ago.
In weeks without seeing my kids, it's very, very difficult.
I've never been that sick.
I'm not at work right now. I'm actually in quarantine. I tested positive for COVID. After
You were a young mom,
patients.
young single mom. You were working.
And just knowing that they had it at my 3 little ones, it was terrifying. Knowing what I brought home from work.
Oh my God, you don't care about me. You don't
I
understand.
see the surge that's going on the hospital floors right now. We're running out of beds. I have had so many close.
This is
what terrifies me
the scariest moment
is running out of space to care for you.
I'm feeling that I am getting punished for making that choice to go out there and help patients.
There's nothing more that you could give, but you feel like what you gave wasn't enough.
So those are some of the faces and the voices and the stories of some of our members among our 100,000 members in SEIU-UHW who've been living and working through this pandemic. I feel, obligated to share with everyone that as of this morning, there have been almost 100,000 frontline healthcare workers in California who've contracted COVID. and just slightly over 400, I think the exact number is 407 healthcare workers have died as a result of the virus since the pandemic began a year ago. And unfortunately, within our own organization, we've lost 47 of our members to the virus in the last year. And the final image on the video is that this is a workforce that we've all counted on and we need. And we feel that there is honestly a debt that we all as Californians owe to frontline healthcare workers and the sacrifice and commitment they've demonstrated. And we want to make sure that we're doing everything we can both to acknowledge that, but make sure this is a workforce that will be able to continue to do their work into the future. We're all optimistic that we'll get to the other side of this, but this has been a traumatic experience. And so AB 650, the Healthcare Worker Recognition and Retention Act, in our minds really is a historic piece of legislation, a first of its kind piece of legislation. And I'd like to just go through who we have with us here today who will speak to the importance and the contents of the legislation. So I'll run through the whole list and then I'm going to return to our author, but I'll share with everyone now that the author of the legislation is Assemblymember Al Murasucci from Southern California, the 66th Assembly District. And he is going to share with us his thoughts about, the importance and the contents of the legislation in a moment. We also have a co-author from the Assembly, Assemblymember Freddie Rodriguez from the 52nd District of the Assembly. And we're joined by a set of patients and workers, including Cece Gomez Gonzalez, who is a patient recovering from COVID-19, Irene Gordine, who's an environmental services tech at Methodist Hospital in Sacramento. We also have with us this morning Norma Hernandez, who's a registered nurse at St. John's Regional Medical Center in Oxnard. And finally, we have Gabriel Montoya, who is an emergency room assistant with Kaiser Permanente in Downey in Southern California. And we are also, I apologize, I should have mentioned, we have a personal care assistant by the name of Eudice Cruz, who's also here and prepared to answer any inquiries or questions in Spanish if that's something that's helpful to any of the members of the press. And so with that, I'd like to turn the program over to Representative Murasucci to talk about AB 650 and his thoughts regarding the legislation. So, Representative.
Thank you, Dave. Good morning, everyone. I'm Assemblymember Al Murasucci, proudly representing the South Bay of Los Angeles County. I am so proud to join our frontline healthcare workers this morning to introduce AB 650, the Healthcare Worker Recognition and Retention Act. Almost exactly a year ago from today, Governor Newsom declared a state of emergency because of the COVID pandemic. Ever since then, while many of us have had the privilege of working from the safety of our homes, our heroes, the healthcare workers, went out to the front lines of this pandemic, day in, day out, to go into combat against this horrific virus. They went to work, putting themselves at risk on a daily basis to take care of our families, our loved ones, those among us who suffered and died from this terrible disease. They went into a dangerous workplace on a daily basis, often with inadequate protective equipment, lack of staff support, long work hours with few breaks in order to take care of others and to save lives. Many have paid the price of frontline work with mental and physical scars to show for it. And too many died in the line of duty. They are our frontline healthcare workers. They are our heroes, and that's why they deserve healthcare hero pay. They deserve frontline healthcare combat pay. AB 650 will require hospitals and large medical groups to pay these healthcare heroes an additional $5 per hour through the duration of this COVID state of emergency. Again, I'm proud to join my co-author, Assemblymember Freddie Rodriguez, and all the frontline healthcare workers to talk more about this bill. Thank you, Dave.
Thank you, Assemblymember Marsucci. And I'd now like to call on Assemblymember Rodriguez to share his thoughts as a co-author of the legislation.
Hello, and thank you for having me this morning. Hi, I'm Assemblymember Freddie Rodriguez, representing the 52nd Assembly District. I'm also chair of the Assembly Committee on Emergency Management. I want to thank you for having me here today, and I want to thank the bill's author, Assemblymember Marsucci, for your leadership. I'm beyond proud of our co-author to be a co-author of this measure. Supporting our frontline medical workers has been my cause since day one of being elected here to the State House. Sadly, we see way too often that our frontline workers are overlooked. With COVID-19 breaking out last year, we found way too many nurses, medical staff, doctors without adequate PPE, something which should have never occurred. From not having the supplies needed to going in and facing worst parts of the pandemic, our heroes have continued to go to work. Today, honoring these heroes for their work and sacrifices is the right thing to do. We may not have exact numbers, but we do know that thousands of essential medical workers fatally contracted the virus themselves. Your work is essential and dangerous, but it is also not over yet. After over a year of the deadly battle of COVID-19, the virus is not yet behind us. Hospital care will continue for thousands of Californians. Like many of you, I am concerned over the burnout and our pre-pandemic lack of qualified medical personnel. I look forward to continuing working on these issues with you. And thank you once again for having me here this morning. And I'm proud to support this effort. And once again, thank you, Assemblymember Marsucci, for your leadership. And I look forward to continue to working with you on this and many more issues. Thank you.
Well, thank you very much, Assemblymember Rodriguez. And as Assemblymember Marsucci laid out, the cornerstone of the Healthcare Worker Recognition and Retention Act is to really recognize the sacrifice and the commitment in the form of compensation premised on a $5 an hour standard that would be paid out to over 1 million frontline healthcare workers if the legislation is adopted in its proposed form in quarterly bonus payments in calendar year 2022. We've seen a lot of activity across California in a similar vein in the supermarket industry, and for all of the reasons that Assemblymember Marsucci laid out, we think that this is an important and needed and principled idea and concept to bring to the healthcare industry, precisely to recognize what this workforce has been through and hopefully to make sure we both recognize and retain this workforce into the future. So with that, I'd now like to call on our next presenter, who is Cecilia Gomez-Gonzalez, who is a survivor of COVID, to just give her perspective around the virus and the pandemic. So Ceci.
Hi, everybody. My name is Cecilia Gomez-Gonzalez, and I'm from the city of El Monte. Now, last year, July 1st, actually, I came down with these horrible fevers, body aches, shortness of breath, and of course, it turned out to be COVID. But not knowing that yet, I went to the ER, and when I got there, I noticed right immediately that there was very short staff on hand, and which was probably about half the size that they normally had. And I asked the nurse, I said, what's going on? Where's everybody at? And she said, well, because the rooms were completely full, of course, bodies were everywhere. And she said that unfortunately from, being overworked and from being exposed to COVID and actually having COVID, they just didn't have anybody else to fill those positions. The other thing I noticed immediately was that not everybody had the proper PPE they needed. They didn't, all of them had masks, some of them had gloves, but hardly any of them had gowns. And I said, well, why don't you have gowns? And she said, well, we don't have any. She said, in the beginning of the pandemic, when the restaurants first closed, their local Red Lobster was kind enough to donate some aprons. So, and I said, so you guys were all walking around with the Red Lobster on your chest? And she was like, well, it was all we had until they ran out. And then that was it. And now if somebody really, really needed a gown, they had to ask their supervisor, and possibly they would get one and possibly they wouldn't. That was why hardly anybody had them. So that was just an awful situation for them. But these healthcare workers are going through so much. And everywhere you go, every clinic, every hospital you see, everywhere says heroes work here. Well, the word hero doesn't even give them the justice they deserve. To me, what they have gone through is what the firefighters and the policemen did during 9/11, but the terrorist attack. But see, this pandemic has since a year ago. So pretty much these workers keep going back into the flames every single day, every single shift to save lives. So we need to do something for them to give them the recognition they rightfully deserve. AB 650 will do just that. And that's why I support it. And that's why I call on the state to pass and enact this law that they truly deserve.
Okay, well, thank you very much, Ceci, and it's a powerful personal story. We really appreciate you being here today. I should mention to the members of the press, we've had a technical issue with one of our presenters, Irene Gordine, and so I'm next going to turn to Eudice Cruz, who is a personal care worker at Cedars-Sinai Hospital in Los Angeles, to talk about her experience as a frontline caregiver through the course of the pandemic. So Eudice. And there you go, Eudice, good.
Okay, hi, my name is Judith Cruz. I am a CNA, means assistant nurse at Cedars-Sinai. Back in March last year, when this whole crisis of the pandemic started, we really didn't know how this virus was affecting our patients. So the sooner that this pandemic started, everything collapsed. And since March up to now, we're still working with patients positive in COVID-19. Our unit on the 7th floor become COVID units since March up to now. Thank God the numbers are down, but we didn't have any break in our floor since then. So we are facing the patients who are really sick from COVID. I have so many experiences that I went through during last year, but it's two cases that really, touch me, and it really, it can, I still have it in my mind. So one of the experiences was that one of my patients came to our floor, and she was walking, she had the symptom of COVID-19, and 2 days later, she couldn't even stand up, and saturation, oxygen, and blood was so low that she need another kind of machine, not just, nasal cannula. And 2 days after, she was already on the BiPAP and she couldn't talk and she was so confused. And in less than a week, she was already in hospice because of the COVID-19. And no family was allowed to come to see a positive patient. So the only one that was there with the patient was the nurses and the CNAs. So we are the only one that they can see, they can talk. Actually, they can even see us because we were wearing our mask and everything to cover, gown, everything. They can even see us. So, but they can feel our touch through the gloves. And the family, on the other side of the phone and trying to reach their loved ones. And a lot of our patients can even talk. So we have to let the family know how the status of their patient, of the loved ones. And I have a situation when one of my patients has to be intubated and the family want to talk to her, but she couldn't talk because she was a lot of shortness of breath. She needs to be intubated right away. And it was only 2 options, intubated to see if she respond to the treatment, but they didn't know if she want to survive the intubation. So the family on that side was saying goodbye to mom, don't worry, I'm gonna be here, I'm gonna take care of my dad, I'm gonna take care of my sister and my brother, mom, we love you. And the mom couldn't say nothing because she needs the air to survive. She just was listening and I was translating to the doctor and the family all crying on the other line. So I started crying too and the patient just crying. I was holding her hand, telling her that it's gonna be okay. But then I knew that it's not gonna be okay. So she left, they intubate her, she left the unit to the ICU. And next day I look and that, she passed away. So those things is daily. I see every single day. We are the one that are with the patient every single day. No, we are the one we're feeding him no matter what. If they're coughing in our face, we have to feed them. We have to wash them. We, the CNAs, the nurses, are the one taking care of the patient. So I think the AB 650 is a recognition of for us, but it's not. We deserve more than that. I'm not talking about money. I say recognition. We need to have this one to pass on because, patient deserve more than that. And we deserve also to be recognized at some point.
Eudice, I know how difficult this has been, and I know you've had members of your own family who've contracted the virus, and just the toll, that being there day in and day out and dealing with people who have no one else, and what just accumulates over a year. So thank you very much for sharing your story. And I'd now like to ask Norma Hernandez to speak. Norma is a longtime registered nurse at St. John's Regional Medical Center in Oxnard. So Norma, thank you for being with us.
Thank you. Hello, my name is Norma, and I am a registered nurse currently working at St. John's Regional Medical Center in the intensive care unit. I have been a nurse for a long time. It will be 30 years in a few months. This pandemic is like nothing I've ever experienced before. COVID patients are many times the sickest patients in our unit, yet it has not been easy to take care of them. We have had to deal with many barriers and obstacles. For example, the shortage of PPE or lack of. When the surge first started, many of us were expected to use the same masks throughout shifts at a time. With the huge surges of patients and influx of patients, we were dealt with having to have shortage in critical care beds and supplies. During this time, management had to create beds out in other units, not initially fully equipped to take care of such sick patients. COVID-19 has been incredibly hard on all of us healthcare workers. It has impacted us all in one way or another. We are all experiencing pandemic-related burnout, exhausted both physically, mentally, and emotionally. Many times I've been the only person my patients see on a given day, the only person that they can talk to, telling them their fears, their anger, their loneliness, as I held their hands, telling them, "You're not alone, I am here with you." Many times I've been the bridge between them and their family members, as I hold up the phone or an iPad for a dying patient so that their family can say their final farewell. I know I am not the only one feeling this way. I've always prided myself in working in a unit where the majority of us have been there over 10 years. Yet never in my life have I ever heard people talk about how they're feeling, how I'm feeling, the anger, the frustration, the fear of taking something home to our loved ones, the losing my empathy and my caring nature. This pandemic is killing our souls. I want people to understand what we are going through. With each patient that dies, we lose a piece of ourselves. We are human and we are hurting. Thank you.
Well, thank you very much, Norma. And again, just, what comes across in your story and your comments is just the real gut-wrenching toll. And, having endured this for a year and what it does to both you as a professional nurse, but then also as a member of your family when you go home and trying to hold all of that together. So thank you very much for sharing your experience. And last, I'd like to call upon Gabriel Montoya, an ER worker from Southern California at Kaiser Downey. So Gabe, got to go take off mute, Gabe. There you go.
Good morning, everyone. As Dave said, I'm an EMT at Kaiser Permanente in Downey. I've been there now serving that community for 13 years. And so, I just got to talk about the experience that we went through over this past year. And this past year, there was a lot of ups and downs for healthcare workers. There was different types of stresses and different phases of this pandemic that I think the public really doesn't understand the kind of, I would say, mental health stresses that a lot of us went through throughout this pandemic. Let me start by saying my emergency department, we had the highest amount of COVID patients in the hospital at one time. The Los Angeles Times printed on December 30th that 80% of our hospital had COVID. 80% of our patients were COVID patients at Kaiser Downey in December. And I got to tell you what that's like. It's one thing to see it printed in a newspaper. It's another thing to live it. I'll tell you, the first thing that healthcare workers encountered was the fact that we knew nothing about this disease. In fact, I watched a video earlier, and a lot of those videos were of healthcare workers talking about it early on. And it took me back to the first time that I had to actually walk into a COVID patient's room knowing nothing about this disease, other than I should probably have a mask on and hopefully there's a gown for me. And I could remember the anxiety. I remember my hands going into a patient that was positive for COVID. This patient was coughing. I can see the patient, was diaphoretic. And I remember my hands, I was doing an EKG on this patient. My hands were shaking. I was sweating into my face shield. I wasn't sure if the mask I was using was going to protect me. I mean, the anxiety that many of us went through was real. We knew nothing about this. And yet healthcare workers, even though we knew nothing about what we were walking into, we still went to work every single day to care for our patients. We still went to work every single day to make sure that our communities were served by the job that we did, regardless of the fact that we knew very little about what was going on. We went through the phase of not knowing what the disease was. And then we went through the phase that came across really quickly of not knowing if we had enough protective masks or face shields or gowns to even care for our patients. We had the phase of thinking about, am I gonna take this home to my parents? Am I gonna take this home to my spouse, to my kids? We had healthcare workers that were living literally in RVs, in tents outside their house because they were just so fearful of what was gonna happen. And yet we still went to work every day and did our job because we knew that's what we wanted to do. And then we went through the surges. The surges can take me back, and I can feel it now, the stress that we went through during the surges. There was a time during the surge, I remember the first day walking into my department and the waiting room had been cleared out of chairs, and we had replaced these chairs with beds and vinyl dividers because there were no rooms in the ER to take care of patients. There was no room in the ICU to transport ER patients to the ICU. There was nowhere to put these patients. So we were treating patients in the ER lobby. I remember walking into the ER ambulance bay and seeing that there was nowhere for the ambulances to park in front of the ambulance bay because we had 2 tents out there to take care of patients. And that's just so surreal about what that felt like. I can easily go back to it in seconds. I think one of the things that we should take away from here is that there were many healthcare workers at different periods of this pandemic that said, I don't know if I want to continue to do this job. I don't know if I can. I'm worried about my family. I'm worried about my own mental health. There are times where we had discussions in the break room about not being able to sleep at night, thinking about the next shift because we had no idea what it was going to look like the next day. You had no idea what you were going to encounter the next day, or if that day would be the day you brought it home. That's the anxiety that we deal with as healthcare workers. And it became very real to us. Remember, we're not just robots that come into work every day. We have families of our own. There are 2 healthcare workers in my department that I can think of now that were, while they were serving patients and caring for patients, their family members were upstairs in ICU. So they're downstairs and they're doing the work for the patients, and upstairs they had 2 family members in ICU, both of which passed away. Continue to come in every day and do the work despite dealing with at home, and that was, I remember sat around in the break room talking about a letter that a patient's family member wrote to her spouse as he was preparing to pass away, and how we read that letter to him, and we talked about it after, and I carried that with me for weeks. And so when we have this conversation about why workers deserve this, healthcare workers deserve this, it was a real physical cost that we paid. It's a mental health cost that we continue to pay. And there are memories that are never, ever gonna go away. And PTSD may be real for us. And there are things that are always gonna be carried with us through this pandemic that is extremely real. And I think that's a lot of the reason why we need to do all we can to retain workers, and we need to do all we can to show these healthcare workers that your sacrifice was recognized. Thank you.
No, thank you, Gabe. And, you know, I just offer my support and thanks to you for being willing to just, you can feel the raw emotion of, you know, how deep and difficult this has been. So before we open it up for questions, I just wanted to summarize again that the Healthcare Worker Recognition and Retention Act, as Assemblymember Murasucci said, is premised on the concept that we both need to recognize this workforce and to make sure that we're able to retain this workforce going forward. And the way the legislation is structured is that it proposes that for full-time private sector healthcare workers employed by entities with more than 100 workers would be paid a $10,000 bonus over calendar year 2022 in 4 equal installments, beginning in January, then April, then July, and then October. And then if for part-time workers, the figure would be $6,000 in 4 equal installments, $1,500 each. And then for less than part-time, $4,000 in equal $1,000 installments over the course of calendar year 2022. And obviously, this is meant to recognize the heroic work that you've heard about here today, but to also make sure that this workforce knows that it's appreciated and there's real incentive to remain in the workforce doing the kind of essential work that's needed and will continue to be needed into the future. So those are the basic elements of the Healthcare Worker Recognition and Retention Act. And we're just pleased and excited that people have joined us today, and we're looking forward to having the debate and to educate the public and to work with the members of the legislature to make sure that we're doing, something like this that is so right and so needed and so appropriate. So with that, I'd like to ask Renee Saldana, our press secretary, if she could help me just moderate any questions or inquiries that members of the press have.
Thank you, Dave. For any members of the press, you can go ahead and raise your hand and we will allow you to unmute yourself and ask a question. And we will take questions in the order that the hands are raised. Or you can also drop any questions into the chat box that they may have. For example, I'm seeing one from Jorge Macias from La Opinión. And Jorge is asking, according to these testimonies, it sounds that not only grocery workers, farm workers, and other essential workers, but healthcare workers are considered disposable workers, not only in California, but in the nation. Why is that?
So I'd ask Norma or Gabe or Eudice, would any of you like to respond to that question? And somebody has a lot of background noise, if you could be mindful of that. Okay, that seems to have gone away. Norma, would you like to speak to that? You have to unmute, Norma. You have to unmute. Thank you.
Can you hear me now?
Yes, yes.
Okay. Can you repeat the question?
So the question, Norma, is that a member of the press from La Opinión says that it sounds from your story and Eudice and Gabe and others that it's not just grocery workers and farm workers and other essential workers, but also it gives the impression that healthcare workers are considered disposable in California and the country. And he asks, why is that? So I just wanted to know if you had a reaction or a comment or any insight on that question.
Está preguntando usted si nosotros somos indispensables o dispensables, porque en mi punto de ver como enfermera, yo considero mi posición muy indispensable. Estos pacientes no pudieran seguir viviendo si no fuera por nosotros, que estamos al lado de ellos días tras días, a pesar de que cargan estas infecciones muy contagiosas, a pesar de tener el temor nosotros de contagiarnos y llevarlos a nuestras familias. Muchas veces hemos sentido culpabilidad de no poder ir a trabajar porque estamos exhaustos de tanto trabajar, porque nosotros sabemos que nuestros pacientes nos necesitan, que si nosotros posiblemente ellos no verán el día de mañana.
Thank you, Norma. And for members of the English-speaking press, Gabe, would you like to comment on the question?
I mean, early on, we really began to feel that way as healthcare workers. I think, many people had this idea. We would often hear conversations talking about nurses and doctors. I'm an EMT. I don't make anything close to what a nurse or a doctor makes at Kaiser Permanente. And so, right away we'd hear about, nurses and doctors and ancillary workers were kind of left out of the conversation, not understanding that many of us live paycheck to paycheck. Many of us, struggle to pay rent probably on a normal basis. And we were not being talked about. And I think people failed to recognize that across this state, there were healthcare workers who, if you didn't have the right letters behind your name, were not being provided the mask you should have been given. If you didn't have the right letters behind the name, no one was worried about whether you took it home to your family or not, including, the hospital administrators across the state, and quite frankly, the media. And so for us, it was a gut check for many of us about, are we really disposable in the eyes of the public? We were being called heroes outside, but being treated differently inside the facility. And so to answer the question, many of us felt like we were being treated as if we were disposable. And I think the world and the nation became they realized very early on in December and January during the holiday surges that they needed us. Because at that point, there was this extreme shortage of healthcare workers across this country. And people realized that even if whether you were a ward clerk, environmental services person cleaning rooms, or an EMT, your services were needed in order to make sure that this was survivable. And we are not disposable. We are real people with real problems, and who are really out there really to serve the public. And we came into this industry to do that, and we continue to do it.
Yeah, and I would just add, that the part of what's been so difficult is the relentless nature of this. And, people have been working full out for 12 months, many of whom are both coping with the disease in their personal lives or individually, as well as, at the work site. And we're all optimistic that we're going to get to the other side of this, but the truth is we really don't know. And the cumulative toll of all of that is very, very difficult. I think unless you're in the middle of it, it's very, very difficult for people to understand. So thank you, Norma. Thank you, Gabe. Renee, I see that we have a question from the Sacramento Bee in the chat. Do you want to summarize it?
Sure. They're asking if the bill, okay, so to confirm, this bill would give $1,604 installments to part-time workers and $4,000 to full-time workers for the calendar year of 2022. Is that correct? If so, why 2022 and not sooner?
Right. So it's off a little bit. So for full-time people, the legislation proposes for $10,000 broken up into 4 equal $2,500 installments. For part-time workers, a $6,000 cumulative total in $1,500 4 equal installments. And for less than part-time, $4,000 or $1,000 in 4 equal installments. And the reason that it's not being paid out sooner, there's some important legal considerations, but most importantly, what the legislation is designed to do is to retain this essential workforce. And we're hopeful that we get through this in the coming months, but we want these workers, to be able to look forward to something that acknowledges their service and provides real incentive to keep them doing these jobs that you've heard about from Eudice and Norma and Gabe and Ceci. So, but I'd certainly, Assemblymember Murasucci or Rodriguez, I'm sure you may have your own thoughts about that. But
yeah, no, I think we should have paid them the hero pay yesterday. But I think, like Dave said, one of the main goals of this is to make sure that all of the healthcare workers, frontline healthcare workers that carry all these scars, that they don't get burned out and they leave their profession. I mean, we all recognize the critical importance of having a strong healthcare workforce, and we have to make sure that we keep them.
Assemblymember Rodriguez, would you like to add any thoughts of yours? Okay. So Renee, I personally am not seeing anything else. You let me know. It's hard to monitor all the pieces here.
We have another question from Chris from KPCC, and he's asking, could Dave or Al clarify if the $5 an hour hero pay that's been talked about is the same or separate from the $10,000 payment for 2022?
So I'll start, and then please, Assembly Member. It's premised on the concept of a $5 an hour. So over the course of a full year, basically $5 an hour equates to $10,000 for full-time employees. But for purposes of retention, the legislation is proposing structuring it as 4 equal bonuses paid out in increments over calendar 22. So same concept, different form, and that's the form the legislation has taken. But Representative Mersucci.
No, that's exactly right. I have nothing to add.
Okay, thank you. I think we can move on to the next question then, and this is from Felicia at the Sacramento Business Journal, and she's asking, what range of healthcare workers would this extend to? Would CNAs, techs, and more be included alongside RNs and LVNs, and would doctors be included?
So the proposed legislation covers all non-executive healthcare workers employed in the private sector by employers with 100 or more employees. So basically the answer is yes. If the doctors are employed by the particular facility, the answer is yes. And I would just add, from the perspective of the workforce, we feel strongly that this has been a team effort. And it's taken everyone from the EVS workers to the medical assistants, to the techs, to the registered nurses, to the physicians. And we're really putting forward the idea that this has been a team, a brutal team exercise. And so all non-executive frontline healthcare workers are proposed in the legislation.
Okay. Thank you. And it looks like we have one more question from the Sacramento Bee. It sounds like this would come out of the state's general fund. Is that correct? And is there a cost estimate for this bill?
Yeah, this bill will be paid by employers. It will be paid by hospitals, large medical groups with employees over 100 employees, but we're calling on employers to pay this.
Right. This is not funded by the taxpayers. This is funded by the institutions that employ all of these frontline caregivers. And frankly, I think we should acknowledge that many of these institutions have received substantial funding, because of the pandemic from the federal government. There's ongoing legislation in the U.S. Congress right now. As I mentioned earlier, the best count we have is we believe this covers a little over 1 million frontline healthcare workers in California. And an estimate of the cost of this is about $6 billion if it was adopted as it's written. And just to provide some context, through the course of 2020, major employers like Kaiser Permanente made $6.4 billion in profit in calendar 2020. The Healthcare of America Corporation, HCA, made $3.7 billion. Fresenius, the dialysis company, made $2.5 billion. As difficult as this has been, it's been an enormously profitable year for many of the leading healthcare providers. And as Assemblymember Mersucci said, we do not expect the taxpayers to cover this. We expect that this will be covered by the employers who've received additional funding in most cases from the federal government.
Thank you, Dave. And we have a follow-up question from KPCC. Will this be extended to eligible healthcare workers if they no longer work in healthcare in 2022?
Assembly member?
Well, that's a question that we'll have to flesh out. I mean, right now we have the basic concept, but in terms of like specific workers, specific circumstances, you know, we'll have to flesh out those details.
And just from a workforce perspective, not a legislative perspective, you know, because it's so important to retain the workforce, you know, we're certainly comfortable with the idea that the bonuses would apply to people who are, you know, actively continuing to work in the industry. And we think that's a reasonable and fair concept, and one we're certainly, you know, prepared to discuss with Assemblymember Mersucci and other members of the legislature. But retaining this workforce is really the primary, you know, goal in addition to recognition.
Okay, and I don't believe there are any more questions from members of the media at this point. So, I'm sorry. We do have one more question from, I believe, La Opinion, and they're asking, taking into consideration the opposition of California Growers Association to pay the hero pay of just $4 for grocery workers during 120 days, do you believe hospitals and large medical groups will be willing to pay and recognize healthcare workers who put their lives on risk every day to save lives?
I believe that they will. And I believe deep down the leadership of the healthcare industry, hospitals, medical groups, clinics, you know, all across the spectrum, I think they recognize, because they're close to it, just how difficult this has been. And I think they also have to recognize that the resources exist. This is the right thing to do. These caregivers have been absolutely heroic for the last year. I myself don't know anything about the Growers Association, so I can't comment on that, but I believe and we're going to certainly do our part to mobilize healthcare workers up and down the state to communicate with members of the legislature, you know, and the public about why this is the right thing, why it's important, and why we all have a stake in making sure that people stay in these professions and are still around to do the work that they do. So we're optimistic we'll have a different experience with the leadership of our industry.
Mm-hmm. And if I can add to that, you know, I represent communities like Torrance in Los Angeles County, which has many hospitals and large medical groups where this legislation is intended to apply to. And you know, I think, like Dave said, the bottom line is we need to do the right thing for our frontline healthcare workers. I mean, every day when I was driving by these hospitals, I would see the signs that some of our frontline workers referred to earlier about, you know, thank you heroes, thank you healthcare heroes. Well, you know, I think we need to go beyond just saying thank you. We need to show them, we need to put our money where our mouth is and express our appreciation to our frontline workers. I mean, you know, we've all seen the TV commercials during Super Bowl and all the other you know, commercials just thanking our healthcare workers. I mean, everyone wants to say thank you to our healthcare workers. Well, this is their opportunity.